So, introducing ICS, it is a psychology organization that works in two departments. First is one-to-one counseling department, and the second is the training department, wherein we have courses for the people who are from psychology and non-psychology background. So today we have a webinar, and before that I request all of you to turn on your camera and to be present till the end of this session, because we are going to share how to get the certificate at the end. So once the webinar ends, don't leave, just wait. We are going to share the message of how to get the certificate. So now introducing you to your webinar facilitator for today. Her name is Sarpita. She is RCI licensed clinical and rehabilitation psychologist, and she's going to take the webinar now.
Hello everyone, I hope I am audible and visible to all of you. A very good evening to all and a warm welcome to each one of you in today's webinar. Myself, Arpita Roy. I'm an RCI licensed clinical and rehabilitation psychologist. So I have been working in multidisciplinary areas, which includes academic fields as well as clinical fields. So I have been associated with a lot of neuropsychiatric clinics, psychological treatment centers, the addiction cum rehabilitation centers, audiovisual production house where I have been associated as personality development counselor. I also have been a part of the National Trust. You might have heard of it. It's a government welfare body for cerebral palsy, mental retardation, and autism. Also, I have been associated with schools and NGOs. I have also been a former lecturer at the University of Calcutta, and I have experience in working with clients having organic disease, mood and anxiety disorders, schizophrenia, personality disorder, mental retardation, and childhood disorders. I also give family and marriage or couple counseling where both premarital and postmarital difficulties are being discussed. And I have also worked with special conditions like deliberate self-harm, bereavement, substance abuse, learning disability, and LGBT counseling. So while working in this wide variety of areas, I have found CBT is one of the major therapeutic techniques that CBT is basically helping us to deal with so many different areas to help the clients. So I'm also an expert in conducting psychometric assessments for adults and children. And I'm a trained psychotherapist, and I use my experience into customizing different therapies, which of course includes CBT. Where also I do go about with a detailed course in CBT. Where also we are having a detailed certificate course on CBT. If you people will be interested, definitely you all will be doing that. Apart from that, I also practice REBT, EBT, MET, play therapy, supportive psychotherapy, and SFBT with my clients. I head my clinic online as well as. So in today's session, we are going to discuss more in detail with regard to CBT, that's cognitive behavior therapy. So we will be discussing about the power of cognitive behavior. So I have just now presented my screen. I hope the screen is visible to all of you. So I would request you all to be ready with a notebook and a pen, because in our session, we will be discussing a lot of things. And this is definitely going to help you gather more knowledge or clarify on certain doubts that you might be having with regard to this area. And obviously, so many things we could be covering. It's just not possible to remember everything. So the presentation that I'm sharing, the PPT that I'm sharing, this is only for presenting during this. So this is not being shared. So you can take notes, that will definitely. So when we are talking about cognitive behavior therapy, yes, this is basically a vast part, a vast area. So when we are talking about what we are going to cover in today's session, so in that case, we are going to first go about with understanding what is CBT. Then we will be discussing about the uses and applications in changing our lifestyle. We would be discussing about understanding what to expect during and after treatment using CBT. We will be discussing how CBT works. The thought, action, emotion cycle, that also we will be discussing. We will also be discussing the ABC cognitive behavior therapy model, cognitive distortions, the various techniques, case discussions also we will be doing. We would also be discussing how different worksheets can be used and basically the different benefits and challenges that an individual can expect from the session. These are the things we will be covering as part of today's session. Now, when we are discussing about this detailed part, and when we can see so many of you have joined in for today's session, I would like to know if any of you have joined in today's session who is coming from a different background rather than psychology, but is interested. That's why may have joined in. Can you please raise your hand or can you please put it up in the chat box so that I can get to understand? And accordingly, I'll basically go ahead with the explanation to make sure all of you are getting to understand and is getting interest in the topic. Yes, I can see two of you. Can you please introduce yourself and mention from which field you are?
Hello, ma'am. I'm Priyanka from Raipur.
Mhm. Yeah, so you are from which field, which background?
I'm a teacher
Okay.
and housewife as well.
So, are you a psychology teacher or some other subject?
No, ma'am. No, ma'am. Not
Oh,
psychology.
okay, fine. Okay. So, how come you developed an interest on this topic? Any idea you are having about CBT?
Not about CBT. I have just enrolled for the psychology course in that institute, na.
Mhm. Okay. Okay. Welcome. One of you mentioned you're a physiotherapist from Mohali, Punjab. Welcome. How about others?
What, ma'am?
So, ma'am, even I am a teacher in a preparatory school. Since my school is an inclusive school and I have to deal with different types of children. So, in order to understand their psychology and their behavioral things, so I have joined this course. But this
Okay.
was my
Okay.
part of webinar.
Great. Welcome. Okay, one of you have joined from law backgrounds, done diploma courses in child psychology and counseling and practical training in counseling. Okay, great. You're welcome.
Thank you, ma'am.
About others?
Yeah, hi, this is Megha from New Delhi.
Yeah.
Although I have been a sales and marketing professional for around 10 years now, but I have a fair experience of counseling people. I started my journey counseling in students like parents because I was a part of an IB school as well. So I think from there on, I understood that yes, this is the path I would like to tread on for the rest of my life. And I think professional journey is somewhat associated with your personal journey as well. I think most of us find sometimes ourselves into oddest of situation, then we have no one to speak with. We usually have family or friends who are there to judge us or pass any judgmental comments. So I think when you have, a psychologist somewhere that you can understand what you are going through without passing any judgments, I think we, especially in India, I think we lack a lot of them, which is the reason I would like to, club myself with this thing, and I would like to move further with this thing as well as a professional journey.
Okay, great. Welcome.
Thank you. Thank you.
Is there anyone else who has joined from a different background?
Hello.
Yeah, Sanjay.
I'm a psychic and a tarot reader, so I would like to help my clients better.
I couldn't hear you.
More
Please come
into,
again.
Sorry.
I couldn't hear you. Please come again.
Okay. I'm a psychic and a tarot reader.
Okay.
So to help my clients better, because most of them are dealing with some, childhood trauma and everything, and they think it's all related like black magic and everything. So which I don't believe more. So to help them better, I will, know more how I can help them better. So that's why I
Okay.
have joined this course.
Okay, great. Welcome. Anybody else? would like to go ahead and introduce who will join from a different background? No? Okay. Let us then proceed. So before we directly move into the topic, let me see what idea you people have. So can any one of you tell me what comes to your mind when you come across this term cognitive behavior therapy or CBT? You don't have to come up with any definition. Like normally when you come across this term cognitive behavior therapy, what comes to your mind? From the name, what do you think? What it is?
I feel cognitive behavior therapy is more or less related to behavioral patterns in terms of anxiety, depression, sometimes underconfidence, or anything happened with in their childhood or something, anything of that sort, which is not letting them release themselves or express themselves. So I'm just assuming this is the thing.
Okay, fine. So let me start today's session. I'll try to keep the session interactive and engaging. So I would like to start the session first with a picture. Take a look at this photo. Whatever comes to your mind, you can type it in the chat box. Whatever you feel. One of you mentioned having different perspectives. What and how to perceive. Clarity, perspective, focus, clarity, and angle of the vision. Going deep to get accurate picture. Okay. Heart of a person, clear vision. Yes. Great. Thank you for actively participating and promptly replying. Yes, many more coming up. Clarity, brain fog. So basically, when we are talking about cognitive behavior therapy, why are we even starting our session with this picture? So obviously, it is having some relevance, that's why, right? So when you change the way you look at things, the things you look at change. That means it's all about your perception, how you are perceiving that. The way you would be perceiving based on that, the meaning, the way you are looking at it, it would change. So why we are starting CBT session just like that? Or it is related to CBT? Yes, yes, yes. Of course, it is related to CBT. Why I'll tell you? Because anything happens, it's all about our perception, how we are perceiving it. So if we are able to consciously change the way we look at things, of course, the things we are looking at, that is going to change. And CBT is basically training individuals to go about with this only. And that's why day by day, CBT is increasing so much, like it's gaining so much importance. And that's the beauty and the power of cognitive behavior. So now if we are talking about CBT in a definition-wise manner, so the entire term of CBT is cognitive behavior therapy, right? So when we are talking about cognitive behavior therapy, it's about cognition, the thought process of an individual, the behavior of the individual. So it is said that our thoughts, our emotions, and our behaviors, all these three things are connected. Take a look at this green color picture, your thoughts, your emotions, your behaviors. So if you are having a negative thought, your emotions would also turn out to be negative, accordingly your behavior. So if we are using CBT, we will be able to deal with all these areas when we are using cognitive behavior therapy. CBT is a form of psychotherapy. It is basically a process of teaching, coaching, and reinforcing positive behaviors for our clients. CBT helps people to identify cognitive patterns or thoughts and emotions that are linked with the behaviors. So what can a person joining for CBT session expect? So the person can expect that this is going to take time, and even if it's taking time, it is going to benefit me. Why? Because the therapist would be identifying my skill deficits and will be helping me to develop on my skills. And the skills that would be developed in me, it would remain with me. So even after the session gets over, then also I'll keep on continuously using and reusing on these skills, and we will be able to carry out with the areas in a better way. So basically, we are equipping the individuals with the skills. So CBT does not make an individual feel dependent. Rather, we are training the individuals to make them independent with the skills. So they are basically getting equipped. Others, can you please tell me, are you all able to hear me?
Yes, ma'am.
You are audible.
Okay, one of you mentioned you are not able to. Can you please rejoin once? Please rejoin once, maybe that could work. Yes. Okay. So, who came up with this concept of CBT? Aaron Beck was the person who came up with this concept. So, Aaron Beck was a psychoanalytic psychotherapist. In early 1960s, Aaron Beck developed an approach known as cognitive therapy. He was basically trying to understand the cognition or the thought process of people who were suffering from depression, like clinically diagnosed depression. And astonishingly, Aaron Beck found that these depressed patients, their thought process is very different from any other individual. In what sense? So it's biased. So Aaron Beck's observations of depressed clients revealed that they had a negative bias in their interpretation of certain life events, which contributed to their cognitive distortions. That means they were in a negative way perceiving, in a biased way perceiving on certain things. And because of that, they were having some faulty thoughts or cognitive distortions. It is a distorted thought, but they were not getting to understand that this is distorted. That was making them more depressed. So Beck called it cognitive therapy because of the importance it places on thinking. It is now known as cognitive behavioral therapy, that is CBT in short, because the therapy employs behavioral techniques as well. Now the next thing comes, then when we are training ourselves in cognitive behavior therapy, then where all we can use this? So we can use cognitive behavior therapy beautifully across different areas. Any idea where we can use it? You can share in the chat box any idea where we can use CBT skills or who can be helped.
I think it is, I mean, just an idea, just a thought that I think it is quite relevant to schools as well, or maybe the corporate culture as well, like maybe sometimes bullying, like, so many school faces a lot of bullying, children bullying each other. So to let that child come out of that bullying nature or to come out of that, like anxiety or disorder or underconfident, feeling underconfident. So many times I've noticed that in the corporate culture as well, if someone is molested or if someone is, eve teased. So even that in case for the women as well, corporate culture, the corporate companies, they hire someone, as a psychologist who come for basically to let the person express or, deal with it accordingly. So I think it is in the school and corporate companies as well. That exactly.
Okay. Okay, many of you have shared in the chat box also. You have mentioned for cognitive distortion, for confidence-related issues, childhood trauma, children facing depression, OCD, counseling, etc. Yes. So basically, CBT can be used in a wide variety of areas. We can use it for clinical population. Clinical population means maybe they are getting a diagnosis, a clinical diagnosis. It's more serious case. For those cases also, we can use CBT. And for non-clinical cases, also we can use CBT. For example, lack of confidence, as you mentioned. Okay. So CBT was originally designed to treat depression. As we just now discussed that he was working with clients who were suffering from depression and we came up with this concept of CBT. But later on, it was seen that it is not only limited to the area of treating depression. It was also helping in mood disorders, anxiety, personality disorders, eating disorders, addiction, dependence, some other psychotic disorders, and many more areas. We were seeing that CBT is helping a lot. So CBT is basically giving the power of consciously changing an individual's perspective. And this is the greatest power of CBT. Consciously, you will be able to change your perspective. Now, when we are talking about CBT so much, we will also have to understand how it works. So the basic premise of CBT is that emotions are difficult to change directly. If you are saying, ma'am, I'm feeling depressed, I say, please put up a smile, you will feel happy. You'll be like, what are you saying? I'll put up a smile, I'll feel happy. So I try to target directly on your emotion. Could I do it? It doesn't work in that way. Instead, I will have to dig deeper. I'll have to understand why you are feeling depressed. What is it that is making you feel low? What kind of thoughts are coming to your mind because of which you're feeling the way you are feeling? So CBT targets emotions by changing the thoughts and behaviors that are contributing to the distressing feelings. So this is how we will be able to help the individuals. CBT builds a set of skills that enables individuals to identify how situations influence thoughts and behaviors. Please put your devices on mute. Yeah. CBT builds a set of skills that enables individuals to identify how situations influences their thoughts and behavior, because based on that, they would be able to understand and go about with the areas in a better light. And nextly, to become aware of the connection between thoughts, behaviors, and emotions. That is also going to help the individuals. And improve on emotional states by changing unhelpful thinking styles and behaviors which are linked to the negative emotional states of the individuals. Here in the diagram, you can take a look. You will get to see from the thoughts, 2 arrows are going. Thought is affecting emotions. Emotions is what we feel, and it is also affecting our behaviors, what we are doing. Now, again, from emotions, one part is going towards the thoughts. Thoughts are what we think affect how we feel and how we act. And another arrow is going towards the behaviors. Same thing for the behavior as well.
Ma'am, I'm sorry to interrupt, but I don't see any slide changing for you.
I have not changed any slide. It's the same slide.
Okay, sorry.
So this is how we are getting to go about with the areas. Now, when we are talking about using the cognitive behavior therapy part, now I will be changing the slide. I hope now the slide is changed for all. So, cognitive distortion. The term cognitive distortion, when we come across this term, what does it mean? It's basically a distorted way maybe you are thinking about something. Okay, so when we are talking about cognitive distortion, it is basically when your brain lies to you. What does it mean? Brain is lying. That means whatever I am thinking as of now, I think it is the correct thing. But actually, it is not so. Actually, it is something else. But I am thinking, yeah, whatever I am thinking, it is correct. Anybody can have cognitive distortion. There are different types of cognitive distortions, basically. Individuals can have more than one type of cognitive distortion. Now the problem starts, like not everybody is requiring sessions for that. Who are requiring detailed sessions? Individuals who would be having multiple such cognitive distortions and it has started to affect them greatly in their day-to-day life. I mean, it has become a normal pattern of thinking for them. So for them only, the detailed therapy sessions might be required. Take a look at the different type of cognitive distortions. All or nothing. Sometimes we call it black and white thinking or dichotomous thinking, but people are thinking in extremities. Either I will become a millionaire or I'll be on the streets. Extremities, as if in between doesn't exist. Overgeneralizing. Once it is happening, and I am mentioning that every time it happens in the same way. So that is overgeneralizing. Okay. Now, mental filter. When we are using mental filter, in that case, basically we are paying attention to certain evidence, screwing evidence as meaning something more than it does. She didn't text back because she's upset. I'm using a filter. Disqualifying the positive. This is also a type of cognitive distortion, a type of mental filter that is discounting the good things that have happened or that you have done. I have made a mistake, so all my success don't count. Next is mind reading, assuming you know what someone else is thinking or feeling. He is upset, so he must think that I am stupid. Next is fortune telling. That is assuming you know what will happen in the future. I know I will never get married. I know I will never get promotion in my job. So it's as if I know what future will be bringing and I'm very sure about it. So that's a cognitive distortion. So more apart from these things, few more are there. Magnification, when we are magnifying certain things, or we are catastrophizing, thinking out of proportion. So everything is a disaster. This will turn out to be that, and we are thinking about the worst possible thing that can be taking place. Next is minimization. Minimization is just the opposite of magnification. Inappropriately shrinking something to make it seem less important, or rationalizing or justification or blaming. So it's not a big deal. If she hadn't, I wouldn't. Another type of cognitive distortion is emotional reasoning. Like an individual is mentioning feeling. Feeling is equal to fact. I feel so, so that must be true. I feel means I feel. I feel cannot always be the fact. But the moment you are thinking in that way, that's the problem. Next, should and musts. Often we say, no, you should have called me. They must have invited me. So using such kind of should, must, and ought to be, it's like I am imposing some unrealistic expectation on myself or my life situation or another person. So that's a cognitive distortion. Next is labeling. Often we lose it. I'm such a loser. I'm such a stupid. So either we level ourselves or we are labeling others. So we are assigning labels and we are thinking that, yeah, we are that only. And last one, as you can see, is personalization. So you are seeing that as if all the arrows are coming towards you. So somebody has passed away and you are mentioning, it's my fault he passed away. Nobody is blaming you and neither it is your fault, but you are saying it. So these are certain things which we get to understand when we are talking about cognitive distortions. So when we are talking about this part, let us discuss with a small case. We discussed, that we need to dig deeper to understand why we are going about in a particular way. Take a look, a small case study we will be discussing. So your friend calls and asks if you will help her for a project for the rest of the day. So you had already planned to catch up with some reading, but you end up saying, yes, I will do so. And later on, we often say that, I don't know, I cannot say no. So what happened? Why you could not say no? So basically, you had certain thoughts. So maybe you were having these thoughts. Here it's mentioned in purple. So you infer that if I say no, she will think badly of me. So you evaluate your inference. I can't stand a chance to have her disapprove of me and see me as selfish. So what is the core belief? That means deep at her heart, what she feels is to feel okay about myself, I need to be liked. So I must be, accepted or loved. So I must avoid disapproval from any source. So if I do this, this means disapproval. So this should not take place. So this is basically an unhealthy way of going about with the areas. So what is happening? You are feeling anxious and you are saying, yes, I will help you. So when people say, I don't know why I do so, this might be the possible reason because of which they are doing so. So this is how basically we dig deeper and we are getting to understand on the areas. One of you asked about any particular tool to assess on cognitive distortion. So when we are talking about cognitive distortion, we get to understand it by talking to the individuals. They come up with certain things that they have been going through, certain doubts and all those areas. So that's how basically we gather more and more information and we get to understand and help the individuals. N number of distortions can be there in truth. Take a look at this simple yet very beautiful picture I'll write to explain CBT. See, the person is having thought with regard to a spider. Oh, spiders are dangerous, they are poisonous, they would do this, they would do that. So what will happen? You would be having an emotion, oh my God, negative emotion. So what would be your behavior when you see spider? Hey, spider, run away. So now this is the behavior and you're like, thank God I could escape. Spiders are so dangerous. And it goes on and on and on and on and on. So using the CBT, I'm going to target the thought. I'm going to bring about a change if there is any unhealthy, unrealistic thoughts. So it in turn is going to bring about a change in the emotion. That in turn will bring about a change in the individual's behavior. And we are done. This is exactly what we want. When we are using cognitive behavior therapy, journaling is a very important thing. And with our clients, we introduce a thought record sheet, CBT thought record sheet. This is the sheet we often use. So where the client is noting on the situation, like you don't have to take a printout of this. In a white sheet, it can be done normally. But the headings should be this things. First thing is situation. Ask the client. Client often mentions, no, ma'am, I don't know. All of a sudden, my mood turned low. So what was the situation? Who was I with? What was I doing? When did it happen? Where did it happen? So they are going to describe it. Next. Because of that situation, for example, the client is mentioning that I called my friend and he rejected the call twice. A simple situation. Because of that, what automatic thoughts came to your mind? That means what went through my mind just before I felt like bad or sad or whatever it is. Maybe the person is thinking that he is rejecting my call on purpose. Maybe he is avoiding me. Maybe he is disliking me. So those are automatic thoughts. Because of those thoughts, what kind of mood or emotion you have been having? Write that and rate it 0 to 100. For example, angry, 99 out of 100. I'm feeling very angry. Evidence for the thought. That means what is the proof or what evidence do you have to support this automatic thoughts that are coming to your mind? And next is evidence against the thought. What do you have that does not support this negative thought? So then based on it, you can have some alternative thoughts. And then finally, you will be having a different outcome rather than the thoughts that you were having. So this CBT thought record sheet is basically a skill that we are introducing with our clients. This is a webinar, so in detail, it is not possible, but in our detailed course, we teach how we introduce, how we start, how we help an individual to identify on the and how they are learning to do it by themselves in future. So that's how we basically go about with the area. So this is basically a skill building process. One of you have asked, when we do CBT with children, they cannot express themselves, they cannot explain us. They say don't know, etc. Yes, CBT will not work for very young individuals because they are not cognitively developed. They are yet to work upon that. For very small ones, it would not work. Although there is no age limit for that. However, if we see that, adolescents, pre-adolescents from that age, it is working. Depending upon their age, depending upon their cognitive sophistication, we may be introducing on the areas. Now, when we are talking about identify on a client's thought process, we will have to identify the automatic negative thoughts. So how do we identify and go out with those automatic negative thoughts and help the client overcome those thoughts? So let us take a look at this colorful picture to understand it. So first of all, identify those automatic negative thoughts. I have identified, for example, 5 automatic negative thoughts. One at a time, we will be addressing those thoughts. So question and challenge those automatic negative thoughts. How we can do it? Is this thought helpful? Is there another way of looking at this? What evidence is there? How would someone else see this? What advice would I give somebody else? Is this fact or is this an opinion? So asking this open-ended questions in a non-judgmental way will basically help the client to think over it, and they will be able to broaden their thought process and come up with more realistic and more optimistic thoughts. And we are done. So these thoughts are often referred to as Socratic question, which a therapist basically in a structured way goes about with asking all those questions to help the individuals deal and overcome the parts. Let me share another case with you all. Take a look. This would also help you to understand how CBT works. So we go about with organizing all the cases in A, B, C format. So A is the activating event. For example, client is mentioning that a friend passed me in the street without acknowledging me. And what is the consequence? I'm feeling worthless, I'm feeling depressed, and I'm avoiding people generally. So what will I have to do? I will have to identify the beliefs of the person. Then only I'll be able to join dots A, B, C. After I identify the beliefs, if I see any of the belief is faulty, then I will be disputing with the belief. And then the person will come up with new beliefs and further action will be taking place then. So let us then discuss what can be the possible beliefs he would be having. For example, the client is saying that he is ignoring me and he doesn't like me. So he is inferring that from that situation. I would end up without friends forever. And this would be terrible. I am not acceptable as a friend. So I must be worthless as a person. And lastly, to feel worthwhile and be happy, I must be liked and must be approved by everyone significant to me. That's the core belief that maybe the person is having. So now that we have identified the beliefs, next thing that we need to do is we are supposed to dispute the beliefs. So on the right-hand side in red, you can see those beliefs, and we are going to dispute those beliefs. The therapist actually goes about with disputing the beliefs. There are many techniques under cognitive behavior therapy. As and when required, we can choose one or more of those techniques to help dispute on those beliefs to help the individuals. Disputation of old beliefs and developing of new rational beliefs to help an individual achieve on the new reaction. So, if an individual is mentioning he is ignoring me and he doesn't like me, so how do you know he ignored me on purpose? He may not have seen me, even if he did ignore. This doesn't prove that he dislikes me. He may have been in a hurry or perhaps upset or worried in some way. Number 2, I would end up without friends forever, and this would be terrible. So, even if it were true that he disliked me, this does not prove that I will never have friends again. And even this unlikely possibility would be unpleasant rather than a source of terror. Number 3, I am not acceptable as a friend, so I must be worthless as a person. So after disputation, there is no proof that I am not acceptable as a friend. No proof. But even if I were, this proves nothing about the total me of my worthlessness. Lastly, to feel worthwhile and be happy, I must be liked and must be approved by everyone significant to me. And after disputation, love and approval are highly desirable, but they are not absolute necessities. But making them so is not only illogical, but actually screws me up when I think they may not be forthcoming. So better I keep them as preferences rather than demands. So this is how we basically go about helping clients. There are different techniques under cognitive behavior therapy, and as and when required, we introduce one or many of the techniques, depending upon the problem, depending upon the client. Few other techniques include cognitive restructuring or reframing, cognitive rehearsal, activity scheduling, behavior activation, behavior experiments. Then we have validity testing, which just a while ago we were discussing. Then we have writing a journal, then successive approximation. These are few of the important areas that or techniques that we are using with our clients to help benefit the client in the best possible way. Now, the next thing that we will be discussing is then how CBT works. Again, with regard to this, let us discuss a small case study to understand better. Mr. T is feeling overwhelmed at work. So he wakes up dreading the work day. When he walks into the office, he is automatically thinking that he will not be able to tackle the challenges of the workday. And this is causing him to feel tense and angry. He is often yelling at his employees who is working under him. So identify the unhelpful thoughts, the feelings, the maladaptive behaviors, because if this is the case that is coming up to us, we will have to then help them to go about with this. So here what will happen, the therapist will basically go about with digging deeper, that is getting to the root cause of the problem. So here Mr. T's therapist employs one technique which comes under CBT, that is guided discovery technique. And in this technique, the therapist asks specific questions about a client's thoughts, feelings, behaviors he or she is expressing during a typical day, which is what Mr. T's therapist is asking him to do. So then she helps Mr. T to connect his thoughts to his feelings at the beginning of the workday. For example, maybe Mr. T is feeling feelings of dread, thoughts of incompetence, and that is making him angry, and because of that, maybe he is yelling. So in this case, if I was saying that only teach the person some anger management skills, this would not have helped. So it helps Mr. T to see that he first needs to work on his feelings of incompetence and dread in order to cure his anger and hostility. Only introducing anger management techniques would not be of help. So in this way, we are basically going with the areas. So this is basically the power of cognitive behavior therapy. And this power we are giving to the clients. The clients are getting equipped with it and they are doing the same. Few more techniques are there, like the guided discovery, which we did discuss, then modeling technique is also there. So as and when required, we are introducing one or more of the techniques to help and benefit the clients in the best possible way. So what are the key benefits? What is it that an individual is supposed to expect from the therapy? So firstly, it allows healthier thinking pattern. Yes, of course, that's what we want. It is creating awareness of the negative and often unrealistic thoughts that's dampening our feelings and our moods. Effective short-term treatment option. For example, improvements can be seen in 15 to 20, 5 to 20 sessions. However, it varies from individual to individual. Effective for a wide variety of maladaptive behaviors, be it at a cognitive level, be it at an emotional level, be it at a behavioral level, we will be able to choose. More affordable than some other type of therapy, because here the clients are learning and they will be able to go about it. Because on the very first session, when a client joins, the first question client asks, how much time will it take for me to cure? How much time I need to develop skills? Or they are like, if I discontinue with the therapy, will my problems come back? The answer is no, because I'm already training you with the skills. It's like you are hungry. Instead of cooking food for you and serving it on a bowl, I am training you how to cook. So even if I am absent, you will be able to cook. You will be able to fill your stomach. Another thing, it is effective online as well as for face-to-face sessions. And it can be used for those who don't require psychotropic medication. All sort of problems, all sort of issues an individual is experiencing. Everybody does not require psychiatric medicine. For example, in case of mild depression, anxiety, like basic level of anxiety, some faulty thoughts that is making me anxious. It's not something clinically significant to be referred to a psychiatrist where I need to take some anti-anxiety drugs or antidepressant. So for those individuals, CBT works like wonder. That's the power of CBT. And another thing, for severe cases also who are already under a psychiatric medication, for them also, for the skill development, see, the skill development will not develop with any psychiatric medication in the world. So the internal changes, the hormonal imbalances, the hormones which are responsible for mood changes, those things we would be able to manage using the medication. But what about the skills? How I'll think, how I'll go about, how I'll manage on my behavior. So how will I go about with that? CBT will equip me. If I am using CBT, definitely I will be able to go about with the areas in a best possible way. Lastly, why CBT? So yes, because CBT is structured, it is focused, it is instructional role of the therapist. Gradual process we see, progress we see in the client step-by-step approach, easy to adapt, skills are acquired by the client and it is helpful for their life. It's not that it is only helping them to deal with the current problem. It's a skill. Future also they can go about in the same way. For example, I'm just training you how to cook rice. So now I've trained you how to cook rice. With rice, what else can be done? You can do, and you can also cook fried rice. So the basic things I'm already training you. So in different areas, you can apply the skills to deal and overcome different problems. Now, just like any other therapy or any other technique, CBT also has certain challenges. So individual readiness to change, that yes, I want to change. This readiness is essential. Also, self-analysis. And if we are giving any homework to the client, that you do the CBT thought record sheet, you do this breathing exercise, you do that, they must do that. If it is not done, if they're like, Mom, I didn't get time, or is it essential? I'm joining the session. So tell the client it will not work, basically. It's not something which works in that way. If you're just joining the session as an occasional observer, you'll just sit for the session, you'll nod your head, you'll go home. In that way, you will not get benefits. So you have to actively participate in these sessions to get the best benefits. Conscious resistance to change, no, I don't want to. For them also, we would see that it is not going to be of help for the individuals. So these are the things I wanted to cover in today's session. So with this, we have covered about understanding cognitive behavior therapy, its uses and applications in how we can bring about a change in our lifestyle and our thought process, understanding what to expect during and after treatment, understanding how CBT works. We also did discuss about the thought, action, emotion cycle, the ABC of cognitive behavior therapy. We discussed about the cognitive distortions. We have discussed few cases and understood how different techniques can be used, what all worksheet we can introduce with individuals. And lastly, we have also discussed about the benefits and challenges. Now, if any of you are having any question, queries, doubts, please come up. We will be having a discussion on it. Anything, please put it up in the chat box. Yes, I can see a hand. Please go ahead. You need to unmute your device or you can put it in the chat box.
I am audible.
Yes.
Yeah. I am doing my psychology, but doing my psychology, MSc psychology. And my kid is suffering with hyperactiveness.
Hyperactive.
Hyperactive, like autism disorder. When we speak to our child with high voice, he
gets triggered.
He gets trigger and he push in front of who is the person.
See, as we were discussing just a while ago, that when it comes to using CBT, for very small individuals, it would not work. So if you are saying a child with autism, that means maybe your child is now 3, 3.5 or 2.5 between that age group. Or maybe earlier times. Yes. So for so small individuals, they are yet to develop on the cognitive part, but then it would not work. Instead, if it's diagnosed autism, we can focus on that. You can check with a psychiatrist and also speech therapist to develop on the speech and to manage on the schedule. So autism specific interventions are to be carried out in that.
Okay. Thank you.
Welcome. Others, any other doubt, question, queries with regard to CBT or how it works or anything with regard to our detailed course on CBT? If anybody is having any queries, please go ahead with it.
So, ma'am, would it be basically that we need to check the age group as well for going ahead with the questions or whatever? I mean, if you have to apply this particular theory, so is the age factor, like it has to be above the age of what? Like, what would you suggest?
No, as we did discuss that there is no fixed age limit, but at least the client should be of average level of current intellectual functioning and cognitive sophistication should be there, that the therapist would have to understand, talking to the client, taking the detailed case history, the mental status examination, that this person is fit for CBT or not. Generally, we see that adolescent period onwards, they can get to understand. So client to client, definitely it is going to vary. So we will have to check on that.
Yeah. So basically, it would mean that we do not have to specially see the age part, but basically, I would say that maybe, there are some people who are pretty intelligent and they can grasp up things easily and they can correlate with things and they can explain things. They could fall at the age of 9 also, because at times children are smart.
Yes,
also,
yes,
yeah?
that's what we discussed.
So basically,
Absolutely.
the intelligence would count of the child, right?
Yes. So that's why we are not having any fixed age group. Maybe the child is 15, but not sophisticated with regard to that cognitive part. So it will not work. Yes.
Thank you.
Welcome.
This is Satish Kumar from Tamil Nadu. I have a doubt relates to this for CBT. See, I'm an industrialist. I've been the part of industrialists in the industrial and organization. May I know the enforcement or applications of the CBT, like when dealing with employees or workers, especially in like the grievance, no, and then the mode of grievance redressal, like the making any fault or making any finding out any problems and sorting out the problems. I may know the applicability of the CBT in related matter.
So see, CBT is a life skill, so anybody can join for the course. But yes, who are from the field of psychology, they will be able to clinically practice that. However, for our purpose also, if we want to develop on our skills, how we will be managing or how we can guide in simple areas, people can definitely join. Yes. So anybody who is interested but coming from a different background, you also can definitely join. Okay. Thank you. Thank you for your active participation. Thank you for being patient and
Thank
being
you.
there
Thank
for
you so
so
much. It
long.
was a beautiful session. Thank you.
Great to hear that. And I hope to meet you all soon in some of our course, workshop, or internship. And you can check the chat box. Okay.